اوكي
تمام، بس هي راحت دلوقتي.
ماشي 65 شايفاها دلوقتي.
اه
65 years old
تمام.
man, chronic smoker, presented 2 months history of enlarged left tonsil, loss of weight, difficult to swallow, cough with sputum, no fever, no night sweating. Okay, anyone? دكتور اوكي دكتور آية ولا فادي اي حد؟
ممكن أشارك
اوكي خلاص. هو في دكتور عبد الله سلام رافع ايده، وبنخلي عبد الله سلام يتكلم. يلا دكتور عبد الله.
Hello.
You can start. Yes, you can start.
Good morning.
Okay.
I'm Dr. Abdullah
Good
Salim, one of the
morning.
exam candidates.
Yes.
I'm Dr. Abdullah Salim, one of the exam candidates. May I confirm your name and age, please?
Yeah, I am Mr. John. I am 65 years old.
Nice to meet you, Mr. John. Today I have been asked to ask you some questions regarding your condition. Is that okay with you?
Yeah, you can start.
Okay. What seems to be your problem?
Say again.
How can I help you today?
It's up to you. You just take a history from me and treat me.
Okay. Since when did this condition start?
I have this problem for 2 months ago, and this problem is I have enlarged in my left tonsil. I went to about 4 doctors. Most of them give me antibiotic, and I don't improve in all this type of antibiotic.
How did it start suddenly or gradually?
No, it starts suddenly. So suddenly I have a little swelling in my left tonsil, and it's little increase in size, but gives me a lot of trouble.
Is it worsening with time or it's constant?
What do you mean by worsening with time?
It's increasing in size with the time.
A little increase. Little increase.
Is it there all the time or does it come and go?
No, it is all the time.
Okay. Do you have any change in your voice?
Any what?
Any change in your voice?
No.
Any difficulty in swallowing?
Yes, I have some difficulty in swallow. I see something inside my throat.
Is it too solid or liquid or both?
No, it is for all.
Okay.
Of course, it's solid,
really
but okay, no problem.
I'm really sorry to hear this. Do you have any difficulties with breathing?
No, but I have some cough with a little sputum.
Any fever?
No fever.
Any night sweats?
No night sweat.
Any unintentional weight loss?
Yes, I lost 5 kilos in the last month.
Okay. Any loss of appetite?
No loss of appetite.
You told me that you have fever. You have cough, yes?
Yes, I have.
Okay, I'm really sorry for this. Okay, is this the first time you have this episode?
Yes, I have. No, it is first time.
Do you take any medications?
For what? What do you mean by medication?
Any chronic diseases like diabetes, hypertension, hyperlipidemia?
No.
Okay. Do you have any vomiting?
No vomiting.
Okay. Do you visit your GP for any other medical conditions?
No.
Have you done any surgical operations before?
No.
Have you been admitted to the hospital before?
No.
Do you have any allergy to some medications or food?
I'm allergic to seafood.
Okay. Have you investigated for this problem before or no yet?
I go to many doctors. Each doctor give me antibiotic. I do not improve in antibiotic. So this is why I came to your clinic.
I'm really sorry for that. May I ask you some personal questions?
Can.
Yes, what's your occupation?
I am a retired teacher.
Okay, with whom do you live?
Here with my wife.
Okay, do you smoke, Mr. Joe?
Yeah, I smoked 10 cigarettes for the last 20 years.
Do you drink alcohol?
Yes, I drink alcohol, 1 can of alcoholic beer every day.
Okay. Do you have any shortness of breath,
No,
any muscle pain or joint pain,
no.
any problem with urination,
What you mean by broken in urination? You mean dribbling?
any problem with urination, any difficulty in urination, starting
Okay,
urination,
no problem.
any disturbance in your bowel,
What you mean by disturbance of my bowel?
any
Diarrhea,
change in your bowel
constipation?
habit, constipation? Yeah.
Constipation or diarrhea? No.
Okay, thank you for being cooperative with me. Do you want to ask me anything?
No, thank you.
Thank you.
So, doctor, what's your diagnosis? Or what's your differential diagnosis?
Unilateral tonsillar swelling. It may be due to malignancy as the patient has lost weight.
Okay, so what type of malignancy? What we called it?
It may be squamous cell carcinoma or
Squamous
lymphoma.
cell carcinoma. Okay, squamous cell carcinoma is in the top. Second can be lymphoma. If the patient have jaundice and enlarged liver and spleen, what it could be?
Enlarged jaundice. It may be due to liver cirrhosis.
No. In this patient, no. If this patient have enlarged spleen and other lymph nodes, what it could be?
It could be lymphoma.
Yes, apart from lymphoma, what else? If associating with fever and other infectious disease, what it could be? You hear about infection mononucleosis.
Yes.
What is this? What is the cause of that?
Infectious mononucleosis.
It is virus. What is the name of virus?
Yes.
It's called. It is Epstein-Barr virus, and it can cause lymphadenopathy. Yes. And tonsil can be when the lymphoid tissue. Okay, so we are with malignancy. Say it is a carcinoma of the tonsil, which is not common but can. What is the investigation you will do for this patient?
First, I will go for blood investigation, full blood count, urea and electrolytes, and the liver function test. And also, I can go for monospot test to exclude.
What is monospot test? What is a monospot test? It is agglutination test. Okay.
Yeah.
All right. What else?
And also, I can go for biopsy from the enlarged tonsil.
No, doctor. In tonsil, we don't have biopsy. You can remove it as a whole.
Excisional biopsy.
It's better to remove it. Okay, no problem. Before biopsy, you need to other radiological investigation.
Endoscopy, radiological investigation, endoscopy.
No, endoscopy is not radiological, doctor.
MRI neck.
MRI or CT, or sometimes you have some sort of the CT and the positron emission tomography, or we have special just for small tumor. Okay, so what is your final diagnosis? You mentioned it is unilateral tonsillar enlargement, can be malignant. This is the diagnosis. Okay, so it is important. This is easy station. But of course, it is tonsil or malignant tonsillitis or malignant cancer tonsil is very rare, but it is just how to take a history. So if you don't ask about allergy, social history, family history, all this, you lose a lot of mark. Okay?
Yeah. Okay.
So it is easy station. It is common. It is shock station. Of course, it is not important from surgical point of view, but it is important for us.
Okay, doctor, what would be the treatment?
What you mean? You just remove it. Just remove it, followed by chemo and the radio. We don't supposed to be specific in ENT, so we don't ask you much in this question.
Okay, and the doctor might ask me what about block neck dissection?
If they have, because the if you have lymph node, you can do that. But nowadays you can give radiation or chemotherapy. You have this station before.
No. I didn't have it before, but I'm just.
Usually nowadays, doctor don't ask you much because you don't supposed to be ENT specialist.
Okay.
All right. Thank you.
Doctor. Thank you.
Okay, so anyone, what is the next one? We have a common case. Anyone? Okay, Dr. Aya Rida. Dr. Aya, we have this scenario. I just share the screen with you. And
معلش
this is
قبلها يا دكتور، قبلها
okay.
بس يا دكتور شيرين، قبلها عايز
Yes.
اعرف ايه المونوسبوت تيست بس معلش. المونوسبوت تيست
Agglutination test.
بيعمل ايه؟
Agglutination test. Just say agglutination test for infection mononucleosis. Infection mononucleosis is by Epstein-Barr. Epstein-Barr virus can cause Burkitt lymphoma in Africa, can cause infection mononucleosis in Egypt and Southeast Asia, and cause nasopharyngeal lymphoma in China. So it is the same organism, same virus, but have 3 different category in different country. Okay, so we tested by agglutination test. Don't need to know the names. It's called agglutination or monospot or ball panel test, but we don't need to know that. Okay. دكتور عبد الله عايز تسأل حاجة؟ دكتورة آية عايزة تخشي في
لا
دي؟
تمام، شكرا يا دكتور.
Okay, you are welcome.
So ماشي هعمل.
Okay, the second
عندي سؤال بس
scenario.
معلش.
Okay, you can ask. اسأل.
انا المفروض ان انا السيناريو اللي محطوط، انا المفروض ادخل بتكلم يعني كان السيناريو اللي قبله كان هو عنده enlargement في التونسلز، كان دكتور
Yes.
عبد الله سأل حضرتك how can I help you، فحضرتك
اصل هي كان هيلب يو دي ما بتتقالش في الهيستوري تيكن، دي بتقال لو انا عندي مشكله، يعني عندي مثلا ايه، يعني العمليه اتاجلت، مشكله في الكونسنت.
يعني انا
لكن
المفروض اسال what's your problem او or what's your complaint.
لا انت مش هتسال خالص، انت عارف من الاول مكتوب في السكريبت ان
يعني
العيان ده عنده تونسيلنال. So I know from the notes that you have enlarged of the tonsil, can tell me about that. واحنا كاتبين طبعا نو نايت سويت نو فيفر تو اكسكلود تي بي، لان الامتحان ده ممكن يتعمل في الهند، ما هم طبعا انترستد بالتوبركلوزيس. يعني هو انت ممكن من السكريبت تاخد كل الداتا، لان احنا كاتبين في نو نايت سويتنج، في كف، في بتاع، يعني انت ممكن تسال من السكريبت.
اسال
نعم؟
تاني عن
هتسال تاني عشان انت ماشي في ستيب لادرز، انت بتسال في كل الايتم اوف هيستوري، لان انت هتسال ان ديتيل، يعني في الكف ده مثلا في سبيوتم ما فيهوش سبيوتم، كلر، حاجات زي كده، بس احنا كاتبينها يعني عشان to distract you from TB. don't insist to ask about TB.
تمام.
It is not important.
دكتور بس هو دكتور ممكن اقول لحضرتك حاجه، بس هو المفروض ان انا لما ادخل على البيشنت اقول له اللي هو هاو كان اي هيلب يو او كده عشان نبريك الايس، ولا هو مش لازم؟
والله انت شايف كده ماشي، يعني اللي يعجبك بس احنا مش هتفرق معانا، انت اهم حاجه تاخد الايتم اوف هيستوري، واخد بالك بس. لكن انت اللي عايز تعمله اعمله، لكن هي مش هتفرق معانا، احنا في ايتم اوف هيستوري، سوشيال هيستوري، الفاميلي هيستوري، كل الكلام ده كله. اوكي دكتوره آية we can start. You can see this is 55 years old man, married, working as a teacher. Now he's unemployed and he have been unable to get an erection for 6 months. Still have morning erection sometimes, normal desire. You can start.
Good afternoon. I am Dr. A, one of the surgical doctor. Can I confirm your name and age, please?
Yeah, I am Mr. John. I am 55 years old.
Nice to meet you, Mr. John. Can I call you John?
Can.
Easy.
Okay. Can you tell me what's your problem today?
Yeah, I have erectile problems. I have unable for erections for the last 3 months.
Okay, I am so sorry for that.
Thank you.
Can you tell me at first you obtain a morning erection or not?
Yes, I have it sometimes, not usual.
Okay. This erection is suitable for penetration or
no, not suitable for penetration, not suitable.
Okay. This erection is associated by ejaculation or
yes, I have normal ejaculation.
Okay. What about your partner? This erection is her sexual desire or not?
No, it's affected her, and she asked me to come to the doctor for check a treatment because you know that I'm still young. I am 55.
Okay. Tell me first, Mr. John, do you have any stress in your life nowadays?
I was a teacher, but they fired me, so I now I employment, but I looking for a job.
Okay, Mr. John. There is any problem with your wife?
No problem. I am okay. We are happy. I love her.
Okay, Mr. John. Do you have any medical condition like diabetes,
Like what?
hypertension, hyperlipidemia?
Hypertension.
Like
Yes, I
diabetes,
have.
hypertension.
No diabetes, but I have hypertension.
Okay, what's the
For
medication?
it is
What
for
is
the
the
last 4 years,
medication
and
for?
I was take a treatment by Dr. Wolverson, but suddenly he died. So I changed my doctor. So the new doctor gave me beta blocker called atenol. They give me 50 milligram tablet twice per day.
I'm so sorry for you and your
No, it is my doctor. No problem.
diet doctor.
Okay. Okay, thank you.
Okay. Now you take atenolol.
Yes, beta blocker.
Okay. What about the other medical condition? Do you have any
No,
other
no
medical
other medical
condition?
condition. No other medical condition.
Okay. Do you take any other medication?
No.
Do you have any allergic for food or medication?
Yes, I'm allergic to seafood.
Okay. What about your surgical history? Do you have any surgical intervention?
Been admission for surgery or surgery done before? No.
Okay. Do you have any trauma recently to your private area?
No trauma, no trauma, no car accident.
Okay. With whom do you live, Mr. John?
I live with my wife and 2 children.
Okay. Do you smoke?
Yes, I smoke 20 cigarettes per day for last 20 years.
Okay. What about alcohol?
I drink alcohol,
you
1 can of
drink
alcoholic beer every day. 1
okay,
can.
Mr.
Okay,
John.
thank you.
Okay, Mr.
Okay.
John. Now, can I ask you some question? Do you have any problem with your breathing?
No.
Do you have any problem with your bowel, like constipation or diarrhea?
First, no heartbeat. The heartbeat is normal, no palpitation. A urinary problem. You mean ask about urine? What is your last
Yes.
question? What you need to ask about urine?
What you need to ask about urine?
Yes.
Any burning sensation with your urine?
No burning sensation. No
Okay,
change in
Mr.
color,
John.
no increased frequency. In urine, you ask about, especially in young, not in old, pain in urination dysuria, change in color like hematuria, increased frequency or nocturia. Okay, what else?
Okay. What about your family history? Did you have anyone in your family have the same condition?
No, I don't ask my family about this condition, but my father died from heart attack.
Okay, Mr. John, I am so sorry for you.
Okay, thank you.
Thank you. Okay, I will contact with my consultant and come to you.
All right,
again.
thank
Do
you
have
so
any
much.
further
What is your
question?
diagnosis? What is your diagnosis, doctor?
It is erectile dysfunction due to beta blocker atenolol using.
Okay. Good. So this is good. So this is due to beta blocker. So this patient have erectile dysfunction due to drug induced, which is beta blocker. It is not. It can be psychological element, but psychology is not important from us as a Royal College of Surgeons. Okay. So what you will do for this patient?
At first, for management, I will set baseline investigation.
No, before
like
investigation.
CBC,
No. We speak about investigation later. But what your treatment?
I will stop beta blocker and replacing it with another
Like what?
Anti-hypertensive drug like
AC inhibitor, like for example, like Coversil or
AC inhibitor.
Berondobel. Okay, but this is can be have more what is called the political answer, because if you say I change that medication, I ask you what medication you give. Okay, so maybe ask you what is the common side effect of AC inhibitor like Berondobel. What is the common side effect of it? It can cause kidney injury and dry cough. Okay, so to avoid asking this question, what is the best answer? I stop this medication, I transfer the patient, or ask the help of cardiologist or internal medicine doctor. Okay, back to the investigation. What investigation we need to do?
At first, baseline blood investigation like CBC and like CBC for TLC count. And after that, lipid profile and the hemoglobin A1C. If patient have
what
diabetes.
Is hemoglobin A1C? What is this? Glycosylated hemoglobin for the 3 months blood sugar. Okay, what else? Serum cholesterol. So just investigation, you can ask for Doppler for pelvic veins or for this area or ultrasound for the scrotum. That's it. Okay, so it is easy, and it is important to know this station. Of course, we have psychological element, but it's not important from us. It is not exam of psychology or internal medicine, but it is important to know that beta blocker can cause erectile dysfunction. Okay, so this is the aim of the question, because we have this question for many, many years, and the student usually insisted that it is psychological element. Psychological element can, but it is not important from our surgical point of view. The important is some medication by mistake can cause side effect. It is like alpha blocker can cause partial hypotension and all this. So, okay, thank you, Dr. Aya. Any question from your side or from anyone?
شكرا Dr. Shirin.
Okay, so it is shocking station, but actually it is not important to know what is the patient have, because it just take a history. If you take a proper history in proper way, you can find everything is easy. Okay, so who's next? We have another simple station. Who need to be the next? Okay, anyone? Is Dr. Abdullah you need again, or what? Anyone instead of Dr. Abdullah? Okay.
Participate.
All right, can Dr. Hussam. All right. This is common station also. If you can see the screen or not. It is
Yes,
55 years old man. You see the screen now.
Yes.
So 55 years old man feeling depressed after left hemicolectomy for diverticulitis, waiting for histopathology to confirm diagnosis. Okay?
Okay.
All right.
Good evening. I'm Dr.
Of course,
okay.
if you see the script, it is important to know what is the patient have. All right. Yes, Dr. Hussam, you are welcome.
Good evening. Good evening.
Good evening.
I'm
Yes.
Dr. Hussam Marzouk, one of the surgical doctors. Can you please confirm your name and age?
Yeah, I am Mr. John. I am 55 years old.
Nice to meet you, Mr. John. So, Mr. John, what seems to be your problem today?
No, I have not feel happy.
Okay, you have changes in your mood.
Yes.
Okay, since when did you?
Since I have these problems, I have bleeding rectum, and I came here and doctor make endoscope for me. So since this is, I am afraid to die from a cancer.
So since you have been admitted,
my father died from a cancer, also from cancer colon.
I'm so sorry for this.
Yes.
And it's too early to say if you have a cancer or not. So we need to do more investigations for this. Okay.
It's already, I have a colonoscope. I think the result was you.
Yeah. Oh, okay. Okay.
You
so
see,
sorry for
you see the diagnosis. Okay.
Oh, okay.
So it is early to know that, or shall I still depressed or what?
No, we'll figure this out. Don't worry.
Okay.
So, do you feel you're feeling down like
Yes.
the previous days? Yes.
Yes,
Do you have?
I afraid from this. Yes,
Oh,
I'm no
okay.
longer happy.
I see. Do you have a change in your appetite?
Uh, I have no change in my appetite and no loss of weight.
You have no change of your appetite.
No.
Okay. What
Sometimes
about?
I don't like to eat because of this bad condition.
Yeah, I see. What about your sleep? Do you sleep?
I have no. Recently, it is difficult to go to sleep.
Okay, okay. Did you have difficulties falling asleep?
Yes,
Okay,
because
and you have. Mhm.
go on, go on.
Sleep. Okay.
Yes, can go on. Okay.
Okay, and you have like difficulty falling asleep, and you have also a disturbance in your sleep pattern.
Yes.
Mhm. Okay, and what about your desire to have sexual intercourse?
No, actually, I have lost my desire.
Oh, I see. Sorry for this. So no sexual drive, no sexual drive. We can say this.
Yes. Yes.
Okay. Did you have any medical condition?
Like
Other
what?
medical conditions?
Like what?
Like any cardiovascular problems,
No, what
for
is
example.
cardiovascular mean?
Cardiovascular, like maybe problems with the heart, like myocardial infarction.
Heart. You know, cardio is a Latin word, is not English word. So it is heart problem, like
Heart
increase heart rate, what we call it in medicine, palpitation can. So I
Okay.
don't have hypertension,
Hypertension, diabetes.
no
Okay.
hypertension, no diabetes, no dyslipidemia.
Okay. And have you been admitted to the hospital before?
No, I just
No,
this
no. Okay.
time, and the doctor do endoscope, colonoscope for me.
Okay. And what about the surgery? Have you had any other surgeries before?
No,
Okay. Do you have the desire to kill yourself or others?
no.
No. Okay.
Mhm.
Did you have the desire of oh, you said okay. Okay. And what about the medication? Are you on any medication right now or before?
No, no medication,
Okay.
no psychiatric medication, no antidepressant before.
Okay. Do you have any allergy from any medication or
I,
any
I
allergy
am
with
allergic to
food?
seafood.
Oh, okay. See. And can I ask you some personal questions that will stay between us?
You can ask.
Okay. Do you smoke?
Yeah, I smoked in cigarette for the last 20 years.
Okay. And do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day.
Okay. What's your job?
I am teacher, still working.
Okay. With whom do you live?
I live with my wife and 2 children.
All right. Do you have any? Did you feel like your chest rising,
Uh,
for example,
uh,
like?
you mean shorting of breath or something like that?
No, I
No,
mean increasing in your beats, in your heartbeats.
no,
Okay. And do you have any chest pain,
no chest pain,
shortness of breath?
no shorting of breath.
Have any weakness in the limbs?
No.
Any problems passing urine or stool?
Like what? Urine like what?
Yes. Urine. You're passing urine.
You
You have
like
any
what?
problems?
What is the problem you mean?
Okay. What's the problem? Like
It is
difficulty
like if you
passing
have pain in urination. No, what else?
pain or maybe the color.
No color change and no increased frequency. I don't wake up in evening to go to washroom. Okay.
Oh, okay. You have any muscle pain?
No.
No muscle pain. All right.
Okay.
Do you have any shaking in your hands?
No.
No. Okay. Do you want to add anything else?
No, I just need to ask you a question. I am afraid from this. due to cancer. What is your opinion?
Shall
I will die, doctor? Shall I will die?
No, I'm so sorry for this. No, I'm assuring you that you won't, and we will help you with this. So we'll do our best.
Can I will die? It is shall I will die? Shall I will die from cancer?
No, because you.
So why?
Why?
Yes.
Because we will manage the cancer, and I'm sure we can help you with this.
Okay, doctor. I just ask you one question. You finish?
Yes.
What is your diagnosis?
He's depression. Yani.
You feel depression is important to be asked in the Royal College exam? It is important to know depression. I don't think so.
Okay.
Okay.
So the investigation.
What's your diagnosis now?
We ask questions like sleep pattern, mood, if he's depressed.
Doctor, you don't enter the exam before, I think. No. Okay. So what you expected in this station, you don't give me a clue. I give you the clue from start. This patient afraid to die from cancer. What the patient is already have? He's in surgical ward. This is not a psychiatry exam. Okay. So what does this patient have?
He have diverticulitis.
You see the screen now. They have diverticulitis. So this patient will die.
He will die from diverticulitis.
Say again.
I'm asking.
I afraid from die from cancer.
He's not gonna die from it.
Okay, but you don't tell me that. First, doctor, you mentioned it is early to describe. Okay, which is wrong because you know the diagnosis. And the colonoscope is done diverticulitis. Of course, the patient maybe don't know what is diverticulitis.
Okay, but it's written here that he's waiting for the histopathology. So supposedly,
are you from your surgical knowledge? You found this is histopathology give you a more detail or not?
No.
No, so it's not important. Diverticulitis don't need to histopathology. Diverticulitis is just to see that this is bowing out from the from this. So this is patient not die from cancer. This patient have no cancer. Okay. So it is important to ask about other system. You ask about other system, and investigation is baseline investigation. I will ask you about the treatment later, but I just review for the other. It is like normal history. It is not psychiatry history. So you need to ask about past medical, surgical, you ask, allergy, you ask, social to ask. So your clinical knowledge is good. This is what I feel. I feel depressed. You ask about sleep mode, so I able to sleep, difficult to getting to sleep, wake up early, change in the mood. You need to ask about, you already ask about appetite and sexual function, and it is important. You already ask about the past history of the same and the medication and all this, and visit psychiatrist before, and this has not happened. So you ask everything. Systematic review, already you ask about systematic review. You ask about other system, medical history, social history, drug history. So if I fail you in this station, it is not failed in the clinical knowledge. So I fail you in which category? In this station now, you take 12 out of 20. You lost 8 marks. So why you lost this 8 mark?
Because he had no cancer, and I said it's too early to.
From the start, the patient have no cancer. The patient afraid from cancer, so don't worry. We already confirm by colonoscope this is diverticulitis. So diverticulitis is not precancerous condition. Of course, it is not like ulcerative colitis. If the patient has ulcerative colitis, maybe have some risk, but this is not precancerous condition. You are okay. Just balance your diet. That's it. But you first you say it is early to describe that, which is wrong. At the end, when I tell you last question, I am afraid to die from cancer. So the patient afraid to die from cancer, you don't say you don't have a cancer. You need to decide it. if I ask you how to treat depression just simple.
الاستاب كويس بس.
ما هو ده common cause of failure. Usually the stem is present inside the station also. If this patient have depression, just regular exercise, regular sleep time, psychological therapy, and of course we confirm with him that he don't have any problem. We can give him like serotonin reuptake inhibitor till the many doctors or psychiatrists explain to him that he has no cancer. Okay? Your history taken is excellent. You ask about all symptoms related to psychiatry, although it is not a psychiatry exam, but it is important to know this is diverticulitis is not a cancer. Okay?
Yes.
So any question? Thank you, Dr. Hussam. Any question?
لو سمحت يا دكتور،
قول.
قلته مرتين اللي هو قلت للاجزاء كانت مرتين ان هو ان انا خايف من ان انا اموت من الكانسر، مره في الاول خالص ومره في الاخر.
تمام.
لو كان هو قال له في الاول ان هو لا انت عندك دايفرتيكولايتس مع نوت بدي كانسرس يو دونت هاف كانسر، هرجع بعد كده
مش هسأله تاني. لا مش هسأله.
لا مش قصدي ارجع انا
لو
بقى
بس تسأل ايه؟
سامعني؟
سامعك.
هرجع اساله تاني بقى على الديبريشن ايبيسودز اللي عنده كلام من ده. انا اصلا انا لغيت السبب بتاع الديبريشن.
لا انا بسأله على اذر سايكولوجي، انا بسأله على السليب، على السكسوال، على النوم، على الكلام ده كله بس.
تمام.
ان عجاله، لكن هو لو ما سالش على الاذر سيستم هيسقط. يعني هو اللجنه دي يعني انت ممكن يو كان فيلد ان تو كاتيجوري.
اللجنه دي انا اخش لها ازاي؟ اللجنه دي انا مثلا انا هبدا اهوت معايا 9 ناس، ابدا ازاي عشان اوصل من عشان اخد ال 20 ماركس مقفولين؟
هو ما فيش حد بياخد ال 20 مارك خالص في تاريخ الزماله ده اولا. يعني. واخد بالك انت اول حاجه تاكد بالاول it is not a cancer. لازم تسال على you need to ask about other system. You need to ask about like sleep
والابيتايت.
ممكن، بس برضو دول مش the most important. The most important to ask about other system. If you miss other system you fail.
ممكن شير سكرين البي دي اف ده؟
say again.
ممكن شير سكرين البي دي اف ده تاني ممكن معلش؟
اوكي نشير السكرين.
سيستم زي الشيست والهارت بيت واسئله عن اليورين واسئله عن الجي اي تي.
طبعا ايوه طبعا. It is exam of history taken not exam for history taken for depression.
اوكي. هل
كنت عايز تسال عليها فادي؟ نعم.
انا داخل
اسئله الدبريشن دي في السكه، لكن انت في الهيستوري تيكن يعني انت the common cause of failure in this station is the student not ask about medical history, history of chronic disease, drug history, family history, social history, allergy. لو كل واحدة 1 2 3 4 5 6 about 7 mark is easy to fail. It is history taken, not psychiatric exam. It is not psychology exam.
اوكي اسالها في عجاله كده بس اتاكد على البوينتس اللي احنا بناخد عليها ماركس على مدار
لا دي اللي بتاخد عليها ماركز يا دكتور. مش في عجاله.
لا انا بتكلم الديبريشن هو اللي في عجاله. السليب سايكل والمود.
اوكي ممكن. لكن انت الاذر سيستمز باست هيستوري فاميلي هيستوري
والسوشيال والبيرسونال
it is the art how to take a history not the art how to take a history in depression.
اوكي
Okay, but he's in problem because he don't decided. You need to be decided. You don't have a cancer.
الأول خالص.
كنت عايز تشوف ايه يا دكتور فادي في البرزنتيشن؟
اصل الاستيشن دي كان حد من زمايلي قبل كده اللي دخلوا الامتحان كان بيقول لي ان المفروض الاستيشن دي ده بيشنت محجوز عندي في المستشفى، المفروض اعرف الداتا كلها عنه. فانا برضه يعني انا هبدا اسال على اسمه وهسال في الاخر برضو على كل حاجه، على الباست ميديكال هيستوري والفاميلي هيستوري والسوشيال هيستوري والبيرسونال هيستوري،
عشان ده ستيشن اوف هيستوري تيكينج.
وانا في البدايه برضو هساله على اسمه وسنه صح؟
هو اسمه عاده في بتاع سلسله في ايده كده عليها اسمه في اي دي باند، بس اساله على اسمه عادي. لو اسمه مكتوب هتقول جود مورنينج مستر جون نايس تو ميت يو اند اول ذيس.
تمام شكرا.
اوكي all right so
لو سمحت
اقول
بعد ما اعرف نفسي كده والسؤال الثاني اقول له برضو اقدر اساعدك ازاي؟ how can I help you today؟ ولا انا عارف ان انا عندك
يا
مشكله كذا
باشا
فانا
you can start as you wish, no problem. Any introduction, no problem. We can هو اسمك ايه؟ You can start with me here. You can start in this scenario. What's your name?
محمد.
Muhammad. Dr. Muhammad, you can start. You can see the screen. This patient, 75 years old, complained of urine retention, admitted yesterday, urine catheter was inserted.
Hello,
Okay.
I'm Dr. Good
Yes,
morning.
can.
I'm Dr. Muhammad, one of the surgical team here. Can I confirm your name and age, please?
Yeah, I am Mr. John. I am 75 years old.
Nice to meet you, Mr. John. So, Mr. John, what seems to be the problem with you today?
Yesterday, I was watching TV. I have desire to go to washroom. I unable to pass urine, so I called the ambulance. They bring me here, and the doctor put me a catheter and found about 2 or 1.5 liter of urine inside my abdomen.
Oh, I'm so sorry to hear that.
Thank
Is
you.
it the first time you have that retention?
Yes, yeah, it is the first time I have this retention, but I usually for the last 1 year I have problem in my urination.
Okay. Does it happen before with you?
No, urine retention not happened before, but I have problem in urination since the last 1 year.
I'm so sorry to hear that.
If I said you, I have a problem in urination, so what you expected to ask me?
Do you go to the loo often before?
Yes, I have increase in frequency. I wake up 2-3 times in the evening to go to washroom.
Okay. Do you feel like it's hard to have a urine?
It is hard to initiate urination, yes.
Okay.
So I have something called hesitancy in urination. Okay, what else?
Okay. Do you have like some dropping of your urine between the your?
Yes, I have. Yes, I have. Yes, I have.
Okay. And do you go to more often at night to the loo?
Yes, I just tell you, I go to 2 to 3 times every. I wake up in the evening, go to washroom.
Okay. Do you feel like you are not completely emptying your bladder?
Yes, I have.
Okay, Mr. Do you have any loss of weight recently? Fatigue, loss of appetite?
Yes, I lost about 5 kilos in the last month.
Okay. Do you have any fever or during last time?
Yes, no fever, no fever.
Okay. Do you see like the color of your urine? Is it dark or black?
No, sometimes it have little red color, but not frequent.
Okay. Do you have any weakness in your legs or your lower back?
No.
Do you have any tummy pain?
No abdominal pain.
Okay. Have you, Mr. John, do you have any problem with your medical conditions? Have any disease,
Like
chronic
what?
disease? Have
Like
any
what?
chronic, like diabetes, hypertension?
No.
Do you take any regular medications or any disease?
No. 1 year ago, I go to the doctor and he gave me alpha blocker called tamsuline. I take it for 1 week and stop it.
Okay. Do you have any allergies?
No,
for food?
not okay. If the patient say I stop the medication, so the next question is?
Why you stopped it?
Yes, I stop it because I just sleeping. I wake up suddenly because someone knocks the door, so I found I collapsed. So I asked my friend, he said it is one of the side effects of the alpha blocker, something called position or butcher hypotension. So I stopped the medication.
You stopped the medication because of the advice from your friend, not the doctor.
No, I don't go to the doctor, so I have position hypotension, so I stop medication.
Okay. Do you have any allergies for food or medications?
I allergic to seafood.
Okay. Have you admitted before to the hospital?
No, I just visited the doctor for this increased frequency in urine.
Okay. Have you done any surgeries before?
No surgery.
Do you have any one of your families like have this condition before, if you remember?
No, but my father died from heart attack.
I'm so sorry to hear that.
Thank you. Okay.
I will ask you some questions about your personal social history, okay? Mr. John.
Before that, if you need to ask me about anything, you ask about loss of weight. Okay.
Yeah.
So anything you need to ask, like if you mentioned it is if any have muscle pain, but I also have bone pain in the lower part of my back. I have low back pain.
You have low back pain?
Yes, I have low back pain. I have loss of weight. I have this urinary symptom. Okay, what else you need to ask?
Do you smoke?
Yes, I smoke 20 cigarettes for the last 50 years.
Okay. Do you drink alcohol?
Yes, I drink alcohol, 1 can of alcoholic beer every day.
Do you exercise regularly or have a healthy lifestyle?
No. Just I am old man, so I don't exercise more.
Do you have a healthy what do you do for a living, Mr. John?
I am retired. I am retired for about 15 years now. I was a teacher.
With whom do you live with?
I live, my wife, I live with my wife. Children is married and far away from me.
Okay. Thank you, Mr.
Okay,
John.
so what's your diagnosis?
Prostate cancer.
Prostate cancer, why?
Because of low back pain.
Okay, but you don't ask, okay, low back pain and loss of weight and prostatic symptom. So which investigation? I have a lot of investigation with me. So which investigation you need to look, which investigation you need to ask me to show to you?
First, blood investigations?
No, just I give you one investigation. What is this one investigation you need to show you?
PSA.
PSA. Actually, this PSA of this patient is very high. So this is, okay, it is a cancer. Okay. So, of course, this is a cancer prostate. Difficult to be benign prostatic hyperplasia. It is not obstructed, no stone, but it's most probably it is malignancy. Okay. So we have another scenario. We use zoo again, but this patient also have hematuria. This patient, the same, he extra worker in dye factory, complained hematuria, admitted yesterday, urinary cluster with insertia. So the same script. Okay, but this is patient is work in dye industry. I will tell you the same scenario, except I have terminal hematuria. Like when I end, I have blood in my urine. What else? Okay, so you can ask again. Just the same scenario, you can ask again.
Okay. Hello, I'm Dr. Muhammad on the surgical team here. Can I confirm your name and age, please?
Yes, I am Mr. John, 75 years old. I have hematuria, and this is blood is come at the end of micturition.
Okay. So can you please tell me, Mr. John, when did you start noticing it?
Yeah, it just last 2 weeks.
How often do you see it?
I just every day from the last 2 weeks, I found that when I end the micturition, it is urine come. So the urine, blood come at the end of micturition.
Okay. Does it change during the day, morning, at night?
No. Sometimes they have blood clots, sometimes no blood clots.
Okay. Mr. John, do you feel like you want to go to the loo more often than before?
No.
Do you feel you are not completely emptying your bladder?
No.
Do you wake up at the night to go to the loo?
No.
Do you have any like loss of weight, loss of appetite?
Yes, I lost 5 kilos in the last 2 months.
Do you have any back pain?
No back pain.
Do you have any weakness of your legs?
No weakness of my leg.
Do you have any burning sensation with your urine?
No burning sensation, no increased frequency, just change in color.
Do you have any fever or you
no
feel
fever.
like
No fever. No fever.
Do you have any blood in your urine?
Yes, I have blood in my urine. This is the main complaint. I have blood in my urine, and this blood come at the end of micturition.
Okay. So have you done?
So if the patient have blood loss, so you can ask about sign of anemia. You have easy fatigability, you're easy tired sometimes. What else you need to ask?
Do you have any medical conditions?
Like what?
Diabetes,
Hypertension, dyslipidemia, no.
No. Do you take any regular medications for any disease?
Like what? So if
Hypertension.
this patient have bleeding, what medication you need to ask about?
Blood thinners like warfarin?
Blood thinner or aspirin? No. Okay, so this is important question. What else?
Do you have any allergies to food or medications?
No allergy.
Have you admitted before to hospital before this episode?
No. No.
Have you done any surgeries before to your
No.
do you remember it, like any one of your family have this condition before?
No, but my father died from heart attack.
I'm so sorry to hear that.
Thank you.
Mr. John, do you smoke?
Yeah, I smoke 10 cigarettes or 20 cigarettes per day for the last 50 years.
Okay. Do you drink alcohol often?
Yeah, I drink 1 can of alcoholic beer every day for the last 30 years.
Okay. Do you exercise regularly? Have a healthy lifestyle?
No, no, no.
Okay. What do you do for a living, Mr. John?
No, I am retired for 15 years ago.
So what you was working?
No, I was a teacher. I teach English.
What do you do for a living?
No, nothing. I am retired now. I take pension.
Okay. With whom do you live with?
With my wife.
Okay. Yeah, have you done recently traveled abroad or something?
No travel abroad. I need to go to India or Egypt, but I have no money. Okay. All right.
Thank you.
What's your diagnosis?
Bladder cancer or
Bladder cancer.
kidney.
But what is type of cancer?
Transition carcinoma.
Transition, not squamous. Squamous in schistosoma, hematuria in Egypt in the past is transition cell carcinoma. So why you ask about travel? It is unnecessary. But what you mean by that?
Because of schistosoma hematuria.
Okay, he's not come to Egypt to go to swimming in the Nile. It's not a habit of foreigner. But what is the risk factor in this patient? If you see the script again, what is the risk factor? I suppose I forget I said the teacher, but actually he is ex-worker in factory. Okay, so what is the risk factor?
Aniline dye.
He's working in the industry. I forget to tell you, but because it is in the script, so it is aniline dye. So it is transitional cell carcinoma. What is the investigation you will do?
Urine analysis and
what else?
Like immunohistochemistry, cytokeratin.
What is this? Blood what?
Immunohistochemistry for epithelial.
Just take a biopsy by cystoscope. Don't be so clever. So what is the difference between cancer bladder and other cancer? In treatment, if this superficial cancer, like superficial layer of muscle, how to manage? Which is not done in other cancer. If you have a ulcer or polyp in the intestine or colon, you remove the whole part of colon. But in urinary bladder, if this superficial cancer, what you will do? Superficial cancer.
BCG vaccination or?
No, relax, doctor. Endoscopic resection. You see the screen up. Endoscopic resection in superficial lesion, if recurrent or follow up by chemotherapy and BCG. Usually done through the catheter. It is not a vaccination. You put it inside the catheter, or you can give it no problem, but just to stimulate immunity. Okay? If failed, you need to remove the urinary bladder. Okay? All right, so it is easy. If you ask about traveling, you need to explain, because the examiner is not supposed to know schistosoma, hematuria, or bilharziasis. So it is not necessary to ask, because we say it is work in aniline dye. But if you need to ask, for example, you travel to India, you go to Egypt, you go to Japan, you can ask something like that. Okay? All right, so whatever, you can see the same scenario. The first one have backache, have loss of weight. The second one have hematuria and loss of weight. So the first one have urinary symptom, so it is cancer prostate. The second one have no much urinary symptom, just hematuria. And this terminal hematuria, which is common with renal cell carcinoma and with bladder cancer. So this is transitional cell carcinoma. So it is easy station, very common, basic. It is important to know the cancer urinary bladder is unique. So in other cancer, we don't do this. We don't do like local resection. It is only done in the spinal cord or focal cord polyps, and also done in the urinary bladder if it is superficial, because the muscle of urinary bladder is 2 layers, superficial and deep. If you have superficial, you can have local excision, followed by chemo, local chemo through the catheter, and immunostimulant, which can be BCG vaccine, which is given also locally. Can be systematic, can be local. I will check for that. Okay, any question till now? We just have few minutes. Okay, we have 2 scenarios. Both are related to orthopedic, is knee and back pain. Okay, so anyone need to share, to ask? Anyone? Okay, Dr. Ahmed Habib. So Dr. Ahmed, you can see now it is 45 years old woman, attend orthopedic outpatient clinic, history of 2 years pain in her right knee. She use walking stick.
Okay, good
Okay.
afternoon.
Good afternoon. Yes, hello.
My name is Dr. Ahmed, one of the exam candidates. Can you confirm
Yes.
your name and age for me, please?
Yeah, I am Jenny. I'm 45 years old.
45 years old. Okay. I know from the notes that you have knee pain. Can you tell me
Yes.
more about that?
You can ask.
Okay, where exactly is the pain?
It is in my right knee.
Okay, when did you first feel that pain?
It is last 2 years I have this pain.
Okay, so you first experiencing that pain 2 years ago. Is it increasing or decreasing?
No, it is on and off.
Is it getting worse?
Yes, it is become more, and now I unable to walk except with a walking stick.
Okay, can you describe that pain for me?
It is like stabbing pain and radiated to my hip, or referred
Okay,
to my hip.
so it radiates to your hip.
Yes.
Okay, do you feel it at certain times or after certain activities?
No, if I walking much, I found this pain.
Okay, so on a scale of 1 to 10, 1 being mild and 10 being severe, can you rate that pain?
It is about 5.
Okay. Have you had any swelling in that knee? Is it
Usually
swollen?
2 years ago, I was playing golf, and this time I have like twisted my knee, so I have swelling, and I take ice and some medication. After that, the swelling is decreased.
Okay, so there is a history of trauma 2 years ago.
Yes, it is like twisted. It is like twisted when I play golf.
Okay, it is not swollen right now. You feel any pain
No.
right
It is
now?
no, because I take pain medication, painkiller. I usually take a lot of paracetamol.
Okay, do you have any fever recently?
No fever.
Okay, do you feel like your knee is giving away while you're walking?
Yes, sometimes I feel that it is giveaway.
Okay, do you feel any looking
What
of
you
your
mean
knee?
by looking? What you mean by looking?
Looking like
You mean that I
feel
straighted, difficult to be back again?
yeah, difficulty to bend it.
Yes, no. Thank God, know that. Okay,
Okay,
all right.
okay. Have you noticed any unintentional weight loss recently?
No.
Okay, so you feel it in your right knee only?
Yes, only right knee. No fever, just referred pain, give way, related to trauma, no looking knee, no deformity, and
Okay.
also no loss of sensation in the lower limb.
Okay, do you have any medical conditions like hypertension, dyslipidemia,
No,
diabetes?
no,
Do you take any medications?
no medication,
Do you have any allergies?
no allergy,
Okay, have you been admitted at the hospital before?
no.
Okay. Did you have any surgeries?
No, no surgery.
Have you investigated this problem before, like doing imaging?
Yes,
or...
yes. By X-ray, nothing. Doctor asked me to do MRI, and he do some special test to diagnose the case. Physical examination.
Okay. Did you know the result of the MRI?
No, I will ask you.
Okay.
Okay.
Has
It
anyone
is something. I think it is something in the ligament.
Okay.
Okay.
Let me ask you some personal questions. Do you smoke?
Yeah. No smoking, no drink alcohol.
Okay. What you do for a living?
No, I am a housewife.
Okay. With whom do you live?
I live with my husband. He's okay.
Okay. Tell me more about your physical activity. Do you exercise regularly?
No, in the past I was active. I play golf. I go to swimming, but now it's difficult for me. But I can go to swimming only.
Okay. Do you have any shortness of breath or
No.
chest pain or cough?
No.
Any pain in your chest, in your tummy?
No.
Do you have any problem with your urination?
No.
Do you have any other pain or swelling in your joints or muscles?
No.
Okay, thank you, Miss.
Okay, I just
Jane.
need to tell you two things. So my sister have Crohn's disease. Okay. So this can be manifestation of Crohn's disease.
Crohn's disease can cause some extraintestinal manifestations like joint pain or skin manifestations like rashes or discolorations, or some eye manifestations like redness or pain.
Okay, so
Yeah,
I don't
so
have
it
all
could
this.
be
Okay, so all right. Okay, so it is important to ask about this, doctor. So it is important in British patient to ask about is any history of inflammatory bowel disease, eye manifestation, or back pain. All
I
right.
thought about
So
this, but the trauma history just shifted me
okay,
toward
yeah.
this.
Usually it is important. So I just what is your diagnosis?
My diagnosis is mostly knee injury related to trauma.
Okay, so it is knee
meniscal
injury.
ligament.
So I tell you, so the doctor make what is called anterior withdrawal test, and they said in his notes the anterior withdrawal test is positive. What it means? What I have?
It means that there is a problem with the anterior cruciate ligament.
Anterior cruciate ligament. Okay, so are you sure?
We cannot make sure only by
No,
physical
you are
examination.
sure because doctor. Are you sure? You are sure because this is
Yeah.
anterior withdrawal mean anterior cruciate ligament, and I think this is confirmed. How to confirm it that?
With MRI.
Okay, so I will show you the result of the MRI. So it is anterior cruciate ligament. So what is your advice to me?
So first, I will advise you to stay
You know
active.
that I have heavy weight. You know, I am now increasing my weight. So what is your advice to me?
My advice would be to be on a diet for weight loss. I will refer you to a physiotherapist to start some exercises.
Some exercise like swimming, okay.
Yes.
And if it is not improved, what you suggest?
I would suggest referring you to an orthopedic surgeon to surgery
what?
like total knee.
It is surgery or scope, doctor. No, not doctor.
This ligament
is young.
injury, sorry.
Okay, ligament injury, young age. So it is just trimming of the cruciate ligament if it's still not improved. She is young. She is not osteoarthritis. She have no something stiffness in the knee joint. In the knee joint. Yes. All right. Thank you. I have someone elevated his hand. Is any question, or we go to the last one? Is backache. Okay, anyone volunteer? It is the last scenario, and this is after that. I think we finish all the history taken. We start next time with phone calls. Okay, so anyone need to start? Okay, I think a lot elevated. We can ask who it is, another آية or the same آية.
لا أنا
Okay, anyone not
بس مش
okay,
عايزة
anyone not share before, anyone not share this station? Anyone?
Okay, Dr. Me, Doctor.
Okay, Dr. Ahmed
Al-Lakan.
What?
Al-Lakan.
Al-Lakan. Okay, all right. All right, thank you, Dr. Reda.
عايزة أعرف إزاي
You have
أقول
question?
تمام.
What is your question? Yes, I hear you. What is your question?
الني لوكينج المفروض إيه؟
الني لوكينج دي حاجة تانية، بس هو سأل عن الني لوكينج قلنا له لا.
أنا بقول
لا اسألي، افتحي بس السبيكر واسألي. انت عايزة تسألي على ايه؟ لا افتحي.
أنا عايزة أعرف
اوكي.
الني لوكينج بقول له إن هو
الني لوكينج بيفتح رجله ما يعرفش يقفلها ولازم يخش اندر جنرال انستيزيا. بيبقى عادة سمول بون او فراجمنت او بون، بيفتحها ما يقدرش يقفلها. واضحة؟ يعني دايما في استقبال العظم تلاقيها في الامرجنسي unable to straighted, unable to bended or flexion of the knee. Okay, not common but is okay. Okay, thank you, Dr. Ahmed. This is the last scenario. 45 years old woman attend an orthopedic outpatient clinic. History of 5-year backache. She use walking stick. You can start.
Okay. Hello, I'm Dr. Ahmed, one of the surgical doctor today. Can I confirm your name and age, please?
Yes, I am Jenny. I am 45 years old.
Nice to meet you, Mrs. Jenny. Do you mind if I take some notes while going on the discussion?
Okay, no problem.
Okay. Can you tell me what seems to be the problem today?
I have a difficult to walking. When I walk, I have this backache. It is for the last 5 years.
I'm so sorry to hear that. Can I ask you further questions regarding your medical condition?
Can, no problem.
Okay. This pain did it start suddenly or gradually?
No, it is gradually. I found the pain increasing with some numbness in my left lower limb.
Okay. Does it come and go or is it constant?
No, it is come and go, but when I walk much, it is increasing, so I use walking stick.
Okay. Can you describe for me the character of the pain? Is it stabby, like
it is like radiating pain, is something like electricity passing from my lower back to my leg, left leg.
Okay. Is there any specific time during the day do you feel the pain?
No, when I'm moving, when I walk much, I feel the pain. When I rest or take a painkiller, the pain decrease.
Okay. Did you notice anything that may increase or decrease it?
No, increase by walking, decrease by painkiller or rest.
Okay. Can you rate this pain from 1 being the best and 10 being the worst, from 1 to 10?
When I walking, it is about A. When I rest, it's about 3.
Okay. Thank you for your cooperation. Do you have any recent trauma to your back recently?
No trauma, but I went to the doctor and the doctor asked me for MRI.
Okay, you said you have numbness at your leg, is that correct?
Left leg.
Left leg, okay. Do you have any problems with your urination?
No. If I tell you, I go to the doctor and he asked me to do MRI, what is suppose the next question? If I tell you, I go to the doctor and he do me blood test looking for hemoglobin. So what you expected the next question you ask me about? What is the result?
Any intention weight loss?
No. I try to reduce my weight because when I went to the doctor make MRI to me. You need to, doctor, you need to know the result or not?
Again?
You need to know the result of MRI or not? Not interested to know that?
I need, yes.
Okay, so the doctor say I have something in my lumbar region, in my vertebrae. Okay, what else you need to ask?
Do you have a stiffness at your back at the morning?
No. Okay. You can
do you
start
have
in
any...
other history.
Okay, do you have any other medical problem like hyperlipidemia, hypertension, diabetes mellitus?
No.
Did you underwent any surgical procedures before?
No.
Okay, do you take any drugs?
What you mean by drug? Medication, you mean? Like aspirin
Medication.
and other? No.
Yes.
Okay,
What?
no.
Okay. Do you have any allergies to any medications or food?
No.
Okay. Can I ask you a few questions regarding your social life?
Can.
Do you live alone or with someone?
Yeah, I married. I have my husband, and he have chronic obstructive airway disease, and he's not working. So I need to work instead of him.
Okay. Do you have any what about alcohol?
No alcohol.
Do you often smoke cigarettes?
No cigarettes.
Okay. Did anyone of your family have a similar condition like this before?
No, but my father died from heart attack.
I'm so sorry to hear that.
Thank you.
I'm so sorry for your loss. Okay. Any tremors or irritability?
No.
Any cough?
No cough. No shorting of breath.
Any irregular heartbeat? Yeah.
No heartbeat. No chest pain.
Any constipation or diarrhea?
No GIT disturbance. No.
Any problems with passing urine?
Like what? Like dysuria, increased frequency, color.
Pain, yeah, changing color, yes.
No. You see the screen or not, by the way?
I'm now, yes.
Okay, all right. Okay, so you need to ask about urine. So I just ask you later while you ask about urine. All right. What else you need to ask? You're finished.
I finished, I think.
Okay, so what's your first? Why you ask about urine? Why you ask about urine? What's your diagnosis?
I
This
think
have a pain. She is young. She have a pain in her back.
numbness in left thigh, yeah.
So what could be? This pain like radiation from the back to leg. What it could be?
Mostly Coda equina syndrome.
Coda equina is occurring Coda equina only and have urine and stool problem.
Sciatica.
This is pain in the back radiated to the lower limb. What we call it sciatica sometimes. Sciatica. What is the cause of that?
Sciatica.
You need to see the report of MRI. You ask for MRI. The MRI is say what you expected in the MRI. The patient says something in vertebrae. What it could be?
Fracture in the vertebrae?
No, fractures. You don't have a trauma. Okay. If the patient asks you, I imagining the doctor that I have real pain, I have a cancer or not? They have a cancer?
No.
Okay, she did MRI, and she did MRI show something in her vertebrae, causing something like sciatica. So what it could be? What is the common problem you can see in the vertebrae in young people?
Disc prolapse?
Disc prolapse. So why you ask about urine? Is important to ask about urine or not? Yes, it is important.
Yes,
anyone can answer.
It can cause dysfunction, yes.
It can cause incontinence. So it is important here. This is from start. If you are first, your mistake, you have two mistakes. If the patient tell you, I went to the doctor and doctor did MRI for me. So can you tell me what is the result of MRI? So either the patient tell you some vague word like I have something in vertebrae, or the examiner give you the report. This is the report from MRI, or show you the picture. So you need, if the patient say data, you need to ask about this data. Sometimes he said the doctor show you the MRI at the end of the conversation. It is important to ask about urine. this is just a disc prolapse, pain radiated mimic sciatica. So this patient have MRI done. So these patients, we have some grading of the this prolapse, and according to the patient complaint, we can do surgery for her. Of course, in social history, she say her husband is not working, she must work. Okay, so this is why she's still working. She don't have a rest, so this is why she still have a pain. So it is just a simple case. It is a case of disc prolapse. Okay. So again, this is the last station of history taking. Next time we have a phone call. And again, history taking is how to take a complete history, including social history, family history, allergic, other system, whatever the scenario, whatever the topics, can be something not related to surgery or related to surgery. You must ask about other system. You must ask about all item of history. We don't be happy if you reach the diagnosis, whatever it is, acute pancreatitis or whatever, and you don't take all these item of history, so you lose. It is important to look in the statement, because the statement tell you everything. What is the diagnosis and all this? The statement is outside and also inside the station. So you can find it if you need to remember what is written exactly. I see some of you have a debate about this acute pancreatitis mentioned by Dr. Muhammad Omar in the videos. We have a lot of videos about that. It is just usually the examiner. What is your differential diagnosis? If say acute pancreatitis or whatever, he show you amylase, or he show you white blood cells is leukocytosis, so it is acute appendicitis. So usually you have a lot of investigation. So you can ask about the investigation, we show you the investigation. Like in the patient with prostate, I show you the BSA is 100, 200. So it means it is a cancer prostate. Okay, so the usually history is including differential diagnosis, including some investigation, not full investigation. But in the phone call, you have full investigation of the patient because you have preparation station before that for 9 minutes. Okay, so anyone have question or have any query?
Yes, doctor, I want to ask you, لو دكتور البيشنت handed me مثلا فايل او شارت او اي حاجه في نص الهيستوري تيكينج، هل المفروض ان انا اخده منه وافتحه؟ قال لي مثلا بص عليه.
هو usually the examiner shows the result, but if the patient, because sometimes in some station or some country, usually they don't understand our language as a foreigner. So we ask the patient, because usually the patient from the same country, so we ask the patient to show him the investigation. But not all the investigation, just investigation which is important, like MRI in disc prolapse, like BSA in cancer prostate. But in the information in phone call, you have all information, all investigation, all details, everything.
دكتور أنا سؤالي هو لو اداني اي حاجه اخدها في نص الهيستوري تيكينج، يعني في ال6 دقايق
لو هي عاده بتبقى حاجه هتفتحها، بس هو عاده بيديها لك في الاخر. هو هيديك ورقه فيها result of something، بس عاده الاكزامينر هو اللي بيوريها لك. وانت بتقول الديفرنشال diagnosis. So what could be, for example, acute pancreatitis, acute cholecystitis. So I show you what investigation you need. I need to see the amylase. This is the amylase. So give you the amylase. So you can find high. Okay, so it is acute pancreatitis. Are you sure? Yes, I'm sure. Okay, especially if you make wrong. Suppose it is a case, have a debate like this case in the video. So can be acute pancreatitis, can be acute appendicitis. So okay, so what investigation you need to looking for? I need to looking for white blood cell. I need to looking for amylase. So he show you this. Okay, this is according what is your interaction. But if the scenario from the beginning, this patient have abdominal pain and he drank a lot of alcohol, so it is clear it is acute pancreatitis. Okay, don't go to acute appendicitis. Okay, any question?
دكتور انا لو طلب الاكزامينر طلب مني ان انا اعمل برزنتيشن، انا المفروض هقول له الحاجات النيجاتيف والبوزيتيف ولا انت ما طولتش؟
حسب الحاله يعني مثلا يعني لو حالة هتقول الهيستوري 45 years old patient have for example urinary manifestation mimic prostate or prostatism, but he have also loss of weight, he have also back pain, so this is go with cancer prostate. Other differential diagnosis can be benign prostatic hyperplasia, can be something. Of course, it is not cystitis because the patient have no fever. So, for example, you can mention no fever, backache, loss of weight. So this is with cancer, not with benign prostatic hyperplasia, not with cystitis or infection. So it's according to the case. If any negative can be diagnosed, it is important, for example, in acute cholecystitis, acute cholangitis. Because acute cholangitis have jaundice, acute cholecystitis no jaundice. Is important from cancer colon and diverticulitis, because cancer colon have no fever, diverticulitis have fever, no loss of weight, no loss of appetite. So you tell him this patient have bleeding of rectum, irritable bowel habit, something, but he have fever, he have no loss of weight, no loss of appetite, so most probably it is colonic diverticulitis. Other differential diagnosis can be cancer colon, but against the cancer colon, the patient have no loss of weight and have diverticulitis, have fever. Or this patient have the same condition for 10 years, so it is not like malignancy, not like diverticulitis, is most probably ulcerative colitis because of the long duration. Okay?
تمام شكرا
دكتور
All right. Okay, كان.
في الامتحان اللي فات زي ما قلت لحضرتك اللي هي
Okay.
الهيستوري بتاع الحالة اللي هي كانت انجوينال ابسس، زي ما قلت لحضرتك اللي هي البنت اللي كانت بتتحرك وكده وتقوم وتقعد وتفرك، ويا دوب قلت لها ثانك يو انا اخدت الهيستوري منك، قامت سايبه الاوضه وماشيه. وفي اخر اللجنه كده قامت راجعه، فانا المفروض اهندل الموقف زي ده ازاي لو حصل تاني؟
هي كان اللجنه كانت ايه؟ كانت هيستوري تيكن ولا ايه؟
هي هيستوري كانت البنت ادكت وجاي لها انجوينال ابسس.
جاي لها انجوينال ابسس. طيب هي التاسك اللي مطلوب منك ان انت تتيك هيستوري اور تتيك ا كونسنت اور وات؟
تيك هيستوري. كانت
تيك هيستوري. شي از ادكت، هاف فيمورال ابسس،
سودو انيوريزم يا دكتور، مش
او سودو انيوريزم، وات ايفر. هشوفها لك، بس هي قامت ليه؟ يعني هي قامت انت بعد ما خلصت الهيستوري بتاعك، يعني انت كنت سالت على الاذر سيستم ولا كنت بتلف في دايره مغلقه؟
لا كنا بنسال.
يعني هي قامت في انهي فيز فيهم؟
لما خلصت قلت لها ثانك يو، قامت سايبه الاوضه وماشيه.
خلاص، ما هي لما دام انت قلت لها ثانك يو، هو انت دايما في لجنه الكلينيكال او في لجنه الهيستوري تيكن وانس ان انت شكرت العيانه تمشي.
طيب.
لان هي انت مش محتاجها، ما انت شكرتها، انت عايزها تاني ليه بقى؟
لا اصلا قصدي في اللجان اللي قبلها كلها، يعني في الكوميونيكيشن التانية والهيستوري اللي كانت قبلها على طول كان فضل معايا عادي، كان قاعد ساكت.
لا دي عادي، دي عادي، بس هي الاصول بتمشي، بس هي ممكن كان في حته راحت تشرب شاي بتاع، ده طبيعي. انت وانس قلت ثانك يو هتمشي.
حركتها اللي قبل كده كان المفروض في وسط الهيستوري كده اقول لها يعني في ايه متوتره ليه او حاجه كده، ولا عادي اساله خلاص؟
لا هي في اسكس في الحوار. if you are standing, the patient is standing, you must stand.
يعني ما كانتش بتقوم، كانت تميل لقدام كده تفضل تفرك في جسمها وفي الكرسي
لا هي عايزه ميمك انها ادكت او حاجه. هي I think she need to يعني what's called to mimic that she is professional actor.
overacting يعني.
Okay, I will speak next time for phone. Okay, about these patient actors by the way. Okay, Dr. Muhammad, what you need to ask? في حد تاني بيسأل حاجة أو عايز يعلق؟
just for confirmation، بس يعني أنا حتى لو العيان already خلاص هو محجوز في المستشفى وأنا عارف الداتا بتاعته، بخش أسأله تاني عادي وآخد منه هيستوري كامل تاني عادي خالص.
هي أنت مش هتعرف كل الداتا، أنت هتعرف داتا معينة ما عدا في الفون كول، لأن الفون كول أنت ما بتكلمش عن بتكلم دكتور، لكن إحنا بنقول لك العيانة دي عندها دايفرتيكولايتس وخايفة من كانسر.
تمام. لا انا اقصد في الهيستوري تيكنج، يعني في الهيستوري تيكنج باخد هيستوري كامل عادي مفيش مشكله.
الهيستوري تيكن اذا هيستوري تيكن زي ما مكتوب في بيلي اند لاف او في هامتون بيلي او في اي كتاب كلاسيك او كتابك اللي ذاكرت منه في سنه 6، ما فيهوش تطورات، ما فيش history of the jaundice is different than the history of the thyroid is different than the history of hernia than in some country believes. زي ما انتم متعودين في مصر كده، ده الهيستوري بتاع الثيرويد وده الهيستوري بتاع الكلام ده مش موجود في حته في العالم. الهيستوري is a history. في item of history you must fulfill it. If you don't fulfill it، لسه واحد مكلمني two stations about capacity of taking consent in the patient have some disorientation. And he failed twice. So I asked him, you ask about allergy, you ask about social history, you ask about family history, you ask about medication. He said no. So I tell him this is why you fail. He concentrate of the hair capacity to sign the consent, which is different. It is okay, but the station is history taken. History taken is a history taken. You must fulfill all item of history taken. And this is the common cause of failure in many countries. History is a history. Reach diagnosis, not reach diagnosis have 1 mark, 2 mark maximum. But if you base allergy, social, family, systematic review, other system, you at least you miss 8 station.
دكتور معلش، هو ايه الستيشن بتاعت التيكا كونسنت دي؟
لا هي ما فيهاش تيكا كونسنت، هي الستيشن هاو تو تيكا كاباسيتي، يعني العيانه ديبريزد او حاجه وانت بتكلمها، دي انفورميشن جيفنج. ما احنا في الكوميونيكيشن سكيلز هيستوري تيكن ده خلصناه، فون كول هنديه لكم المره الجايه. في حاجه اسمها انفورميشن جيفنج اللي هو تيكا كونسنت او كونفيرم كونسنت او بيشن ريفيوز تو دو اني مانوفر. دي هيستوري تيكن برضه، بس هيستوري تيكن اندر انفورميشن جيفنج. يعني هيستوري از انفورميشن جيفنج اند انفورميشن جاذرنج. انفورميشن جاذرنج اللي هو الهيستوري تيكن الكلاسيك اللي احنا بنعمله ده دلوقتي. انفورميشن جيفنج ان انت هاو تو كونسنت بيشنت، هاو تو بريك باد نيوز. اوكي but still history have the same item of history.
كان في
انا هسألها عن الفاميلي هيستوري انا هسألها عن الفاميلي هيستوري انا مش واخد بالي من الاستيشن اللي زي دي كده يا دكتور معلش.
History is a history. If the station is history taken, you must take a history. يعني انت العيانه مثلا you need to she patient, I think this scenario is a patient have total hip replacement redo and she is not much oriented, so can be hypoglycemic, can be electrolyte disturbance, so you need to ask about that. تمام. We will discuss in the third station, not the next time, the time after information giving. Any other question?
دكتور هو حضرتك قصدك على الكوميونيكيشن، يعني personal communication؟
Yes, it is a communication skills. Yes, communication skill is 3 category: phone call, information giving, information gathering. Information gathering mean history taken. Information giving how to consent the patient for maneuver, patient refuse a consent, patient whatever.
يعني counseling والconsent ولا
yes
مثلا لو anxious mother أو كده.
Yes, okay. If you need to know much about communication skills, I think the best book is Catherine Barsham Smith in Communication is the best one. Okay, or go to Wikimedics. They have a lot of data, by the way. Or you can just Google my name and you can find a lot of videos about that. Okay, so see you next time. Next time we have phone calls.
ناخد الستيشنز كلها فون كولز يا دكتور ولا نقسمهم برضه؟
لا الفون كولز هتبقى one time because other phone call I think you take it in the real course or in some groups will take it in the next course.
هناخد
I
بعض
give you the
منهم مش
list of
كلهم يعني.
all. لا I will give you the list of all of the phone call is according to the time. We can make it all, no problem.
Okay دكتور ماشي.
Okay, we discuss next time. Okay, thank you. Okay, best wishes and good luck. Okay, السلام عليكم. Bye.
عليكم السلام.
Bye.
السلام.
Okay.